That's the reason that one of the injection is very important to keep it very, very superficial at this level. Then here, we can see the superficial, yes, we can see here the subcutaneous tissue, the temporoparietalis fascia, and together with the superficial layer of the deep. This is the deep layer of the deep, this is the deep fat, and then this is the medial temporal vessels that will come, and it will continue. We don't see it here, but it will continue all the way to the close to the frontal bone. But also there is a branch right here lateral to the orbicularis oculi muscle, and this is the sentinel vein that will come out into the subcutaneous tissue to become more superficial. Right here, this is the orbicularis oculi muscle, and right here is the anterior auricularis muscle. Now, and this is the typical example that we'll see when we are dealing, and this cut still is above the cornea. Here we can see just the lens a little bit on this. This cut here is the patient tilt a little bit, and here is still more superficial. But here we can see the skin with the dermis included, of course. We can see the superficial, the subcutaneous fat, but we can see how the subcutaneous fat is infiltrated also into the temporoparietalis fascia. And then we have the superficial layer of the deep, and here will be the deep layer of the deep, and this will be the deep tissue. Now here, we'll see now the artery, the mid-temporal artery, how it comes from the inside the fat pad, the deep fat pad, and it travels and goes inside the muscle, and it will communicate with the anterior and the posterior arteries. And here we can see some portion of the vein going into the lacrimal